Okay. We are live.
Okay, great. All right. It is 7:05 and I'm calling the special meeting of the Community Services and Personnel Committee to order. Roll call. Me, Barbara Smith, Greg Burnett.
Present.
Ernie Dumas. Dominic Johnson.
Present.
Tom Keegan.
Here.
Kadeem Roberts.
Present.
Nick Sacinelli. Okay, we have 1, 2, 3, 4, 5 present. We have, I'm sorry, 1, 2, 3, 4. Yeah, 5 present. We have a quorum. First thing on the agenda is public comments. Do we have any public comments? Anyone who would like to make public comments, Larry?
We do have one person under attendees, Kelly. Kelly, if you'd like to make public comment, please raise your hand electronically and I will unmute you.
Oh, Kelly's a reporter.
Kelly, oh, okay.
Yeah.
All right. There's no one raising their hand.
Okay. Do we have anything that was mailed, any emails? Either Mr. Burney or Mr. Daniels? Nope. Okay.
No, we do not.
Okay. So I will close the public comment section. Next on the agenda is the approval of the minutes from the meeting held on February 19th. Do I have a motion?
I'll make that motion, Greg Burnett.
Okay, thank you, Mr. Burnett. I do see one minor error that needs to be fixed, which is the spelling of my name in the discussion and vote on draft procedure, where it should say Ms. Smith move. So it should be Smith, SMYTH''S, included senior services. Anyone else see anything? Okay, so let's vote on the minutes as amended. All in favor? I think we could just do an aye, but everyone speak and raise your hand. So all in favor? Aye.
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 Opposed? Abstentions? Okay, motion passes unanimously. All right, next on the agenda, it's been quite a while since we've met, and we, first because of COVID, the emergencies, then we had babies being born, and congratulations publicly to Lamont. And so we're glad to get things back going now. And we've got some really important information that Lamont's going to share with us, an update on the Community Services Department, and then subsequently, an update on the progress of the Equity and Justice for All Commission, which is very important to all of us. So we're looking forward to what you have to share with us tonight. So
Thank you, Madam Chair, Madam President, and good evening, everyone. Let me prepare. If you know me by now, I'm going to have a slide deck for you.
the best. You're the best at this.
I enjoy making them. Okay. Let me just. So thank you, as the Madam Chair indicated, the purpose of today, and thank you all, for the many congratulations and emails congratulating us on our second child. Just want to share for the record, his name is Connor Patrick Daniels. He came to us 8 pounds, 6 ounces. And we're really excited to welcome to join our 6-year-old daughter. So thank you. So we did take some time off. And so when it was time for this meeting, I said, well, I would like to take the day off. Is that okay? And Madam Chair said, absolutely. So thank you. So a lot has been happening under the Community Services Department. So the purpose of today is really to give you a status update of the things that we've been engaged in. I'll also talk later on of where I see the work moving. Obviously, in light of COVID-19, it's just changed the game in a lot of ways. but I'm very proud to say that because of the restructuring and the development of my department, it really has positioned the city through the department to really be an active player in what's happening as it impacts Norwalkers, from the little ones up into our elders. And I also would say that in a lot of ways, while COVID has really hit our community hard, and we hear of the deaths and horrific experiences that family members have to experience because of this vicious virus, it also has galvanized the community from a social service perspective to really come together and say, we really have to be in this together. We really have to look at how we support one another, how we deploy resources, and just how we work with families in a different way. And it's important for me to mention that even prior to COVID, and you all know this as well as I know, there are families that have been struggling prior to COVID, and COVID-19 has just exacerbated whether loss of jobs, a loss of a loved one, or even just the many different things that families have to struggle. And then of course, this online learning, distance learning, what families have to do. Do I stay home? How do I work? How do I find childcare? How do I support my child on the system? And then the other piece, that there's families and residents and individuals who for the very first time, who found themselves in the place of saying, I need help and what do I do? And so, and we're here in the community. I want to, acknowledge the many nonprofits and social service programs throughout our city who are all doing a phenomenal job, with the capacity and resources they have to respond and help our community. So I definitely, and we can't do this without those on the ground working. And so just want to remind us, it's been a while, that the charge that I have been giving is to increase and sustain the social well-being of our health, social well-being and health of all Norwalk residents. And my office, my goals are to unify the initiatives and programs that affect the social well-being of our residents. I also provide oversight to the city departments that are under the community service umbrella, and I'll talk about what they've been doing as well. And then the big piece that, that's keeping, us very busy is identifying the resources and opportunities to respond strategically to the emerging needs. And I'll talk about one of those emerging needs is food, but also what are the trends happening and how do we as a municipality work with our nonprofit partners to really set some strategic plans and resources to support what those trends are that we're seeing in our city. And so in terms from a leadership perspective, and this was a slide that you've seen earlier on when I presented to you, that the city of Norwalk, meaning through this position, we are well positioned to make a significant contribution to support and coordinate the social services delivery system. That is why you all voted and supported this department. There was a gap in how organizations work together. And then secondly, we're now delivering on an actionable item. I mentioned a while back that I had an opportunity that when I came on board, that I did a listening tour talking with the executive directors and organizations and leaders and community groups. And one of the things that they identified as a need is that help with coordinating and bringing folks to the table. Well, that is exactly what we're doing. And COVID-19 has really pushed us to do it even better and much quicker. It's really accelerated the process because we all identified that we need each other in these uncertain times. And then lastly, I'm proud to announce that we finalized a candidate. We ended up doing the virtual. When we were in the process of identifying the candidates, we had to go to everything on virtual. So we completed our virtual interview, which was very different for me. So we all had to adapt and be flexible. That I'm very proud to say that we found some very, very fine candidates, and I'm hoping to make an offer fairly soon for the Director of Human Services. So that means my department will be complete and we can really continue to do the great work that we've been set out to do, and that is support the social service delivery system and also identify specific tasks that we as a municipality can play. And so what have we been doing? One of the things that was very important to me is looking at the data. And this is something that, over time, I really would like to engage this committee around that there is data in the city. There is data that is reliable and that is valid. So this is just one example. I'm not going to talk too much about this particular map, but this is a map that identifies where are the food insecurity gaps in the city. And you can see those dark colors. And again, we're not going to, spend a lot of time, but we know where the needs are. We know where the pockets are. So it's be very important that as I continue to evolve and shape the department, that we really look at and be informed by the data. Where are those communities? Where are those neighborhoods that are struggling for a variety of reasons? And then how can we deploy and identify resources and work with our nonprofit partners to say, you know what, we may not need that food pantry in this specific area because based on the data informs us that the need is really here. So what can we do strategically to really provide those services in particular neighborhoods and communities where the need has been identified? And we've done that with the school and community sites that I'll talk about. And so we have data with our data partners, look at demographics, look at health, look at education, look at employment. And we have some really sophisticated data from our partners to really start thinking about what's happening in our city and where are those neighborhoods and communities that can use a little extra help and some strategic resources or some strategic interventions to support those communities. And we have that. So whether it's through the health department have a grant from Healthy for Life Project. And prior to my arrival here, the health department received a grant from the Fairfield University to really map out where are some of those needs. So I'm really doing kind of what we call a data dive and really looking at the data and then thinking about based on the data, what are our priorities? What are the strategies, and then identifying what are the resources that we need to really respond to these communities. And so as I always talk about data, I have to talk about Norwalk Acts. Norwalk Acts is the collected impact organization, the convening body that does just that. And so if you look on, it'll be on my left, I'm not sure what it'll be on your screen. This is actually a real map that identifies where are the free and reduced children in our city. We know where those families are. And based on this map from Norwalk Acts, we were then able to partner with the Norwalk Public Schools to identify where are the best locations that we should open up the food sites, whether it's a local school or whether it's a community site. And this is just one example that through my office using data and partner with our Norwalk Public School to identify where those school sites. And I'll be able to share with you for 1 month what those numbers are momentarily. And so the data told us automatically that people need food. And so that was, again, one of those emergent needs, which over the past 3 months, that our department played a very key and pivotal role to galvanize the food pantries on a weekly call to identify who they were, what they were doing, what their inventory looked like, and how can we ensure that all Norwalkers know about the services as it pertains to food. Because we know that since COVID, there's been an impact on employment. For the past 2 months, the demand of food in our city has increased. We had some new challenges in food sources. If you read the news, we just haven't been able to get the food into our city as the demand, but that's changing now because things have leveled off. But I want to be clear, the need is still there. And then having strong coordination and collaboration with our local food pantries. It was our department that brought the food pantries together to talk about how can we work together and how can we ensure that we're meeting the needs of our community. And so just to kind of give you a sense of what's been happening, I asked the nonprofits, can they kind of give me, what have their experiences been? So person-to-person reports that because of COVID, they have seen a 50% increase in demand. And that's 150 increase in the demand for rental assistance because they offer a rental assistance program, but because of COVID, that increase has been over 150% based in March and April. And approximately every week, they're serving about 150 to 210 people asking for food. And they are our largest food pantry. So this is not an unusual number, but just to give you an idea of what the need has been because of COVID. Over at Salvation Army, they have estimated to us that they've seen a 35 to 40% increase in the demand of food as a result of ordering food once a week because of COVID. And then Open Door Shelter, they are our only in-house shelter for our city. They've seen a 30% increase in food based on since early March because of the need. And then they all report, the challenges of staffing and volunteers, because if you're gonna increase your food program, you're gonna need volunteers. They're not hiring. These are run by volunteers. And I can say that, we're doing well, but just to get a sense of that's always a need for volunteers. Many of these organizations rely on a strong volunteer base to help with their bottom line. And we're really excited or proud that through our emergency response team led by Donna, we have a strong volunteer program. So again, the city has been able to respond and deploy volunteers for many of these organizations to serve our residents. Our food distribution, again, just to give you an idea, since the pandemic, our office initiated the first food delivery program. When the numbers were really high, we recognized that many that was impacted or affected by COVID, they could not go out for a variety of reasons. So we partnered with the local CAP agency from the Alliance, which is formerly ABCD. They're now called Alliance for Community Apartment. Since the program has started in March, they served 175 families, and that's 553 individuals. They triage. Families would call and say, I need help. Because of COVID, we will connect that family to a food pantry program. The Blessing Boxes, some of you have volunteered through the Cornerstone relationship. And I might say that the city also is playing a role financially. While I get a lot of calls from funders asking how can we help. So through our office, we're making recommendations. Hey, there's the Blessing Box program, this program. Obviously we can't, can't be biased. So we tell those that want it, these are the programs that you can consider, and then they've been able to deploy resources, and we've been able to, on average, I believe right now, through our relationship through funders, we've been able to help the Blessing Box program with $15,000 in grant funding outside from even private donors to support. So since we started, over 2,000 boxes of food have come through the city of Norwalk, and we see this as a supplement program while we're using the food pantry systems that are existing, but again, they are in high demand. So this was another layer to bring more food in. Each box can feed a family of up to 3 for 3 to 4 days, and that's been calculated. Over 70,000 pounds of food have been brought into the city in this one program. And then the other thing that I'm really, really proud about that I do spend a lot of my time is partnering with the Norwalk Public School System. For the month of June, they've served 76,492 breakfast meals to residents. That's not individuals, it's meals. Because sometimes families are family of 2, 3, and 4, but it just gives you a snapshot of what the need is and what those numbers look like. And for lunch, that number equates to 77,690. So I have to ask, are people just asking more? They may like the lunch meals better than the breakfast. But one of the things that we added, and I have to also acknowledge my team, Darlene Young on the community service, human relations sphere, has really been a key player helping me navigate the players as I still learn. She's really taken the leadership role. So these sites are actually, we call community sites now. So because of Kevin McGinnis from Chartwell, we actually offer a lot of other resources. We provide information on SNAP enrollment. We provide information on census, because that's a big piece. We want to make sure our residents are counted. And we also, as information comes to us, we're actually providing information at these sites. So it's not just families going to get food. We're empowering them and providing education awareness on other services. We also give information on where the local food pantries, because they're just meals. And we know that this may just help for that day, but families may need more. And some of you have volunteered. You all know that my office orchestrated and organized the Connecticut Food Bank that happened in our city back in May. We served over 2,000 cars, and we were really excited. And I have to take pride to all the city departments, the police, public works. The Connecticut Food Bank has informed us that this was the largest they've done in the state in many, many years. And I take pride that and hope I don't get in trouble with saying this, but they have said that it was one of the most organized effort of coming to our city, having our department step up to the plate and really make this seamless for them as they partner to do this. And so what we have been doing, give you a sense of our involvement, what's been happening in the department. Well, I now have transitioned to bi-weekly calls. So every bi-weekly, I have a senior services call because we got to know what's happening with our senior population. I think when I reported to you all early on, that is an area that I want to play special attention moving forward. But again, because of COVID, looking at priorities, that definitely still is something I want to, really look through, identify and see what supports. And then we have the amazing emergency response team from the health department. They deploy a lot of volunteers throughout our city to help the bottom line with our nonprofits. I'm also involved in ensuring we don't forget people's mental health. I mean, I calculated, we've been home since March. That can be a lot for families. As you all know, I am still a licensed clinical social worker. So my clinical hat is always on to ensure how are our residents doing, those who have to stay home. And not only that, around domestic violence, we hold domestic violence calls to ensure, how do we identify the resources? How do we give strategic messages to those that may be in situations of how to call? So we want to continue awareness. As I mentioned before, we have the nonprofit community and social service call that's held every weekly. I already talked to you about our domestic violence. We're also partnering with our LGBT community. Thank you, Councilwoman Dominique. I met the new interim director. And so my goal is to ensure that all populations are not only served, but that the city know who they are and where we can support and provide assistance. That's my goal. The homeless shelter, we were very instrumental working with our state to ensure that our homeless population, especially again at the height, we were able to deploy them through state funding and local hotels, and then the Food Access Initiative. And then, one of the city departments that we actually have and run is our Human Relations and Fair Rent Department. They are very, very busy because we know if you don't have money to pay your rent, the landlord may be trying to evict you, but we're very happy that the governor has extended the evictions. However, that won't be there forever. So we are working tirelessly to inform our community around their rights. Unfortunately, we do have calls where in this time, landlords are raising their rent. And so we're working with the tenants. And if in fact it's illegal to raise the rent at this point, we're providing the resources to that tenant or telling that landlord, hey, you can't do that. So we're taking shape. We are becoming that community convener to help identify solutions that have the greatest impact. We are looking to build that community resource hub through the hiring of that director of human services director. And you also approved through the Common Council those 2 part-time community resource workers. So we're now starting to think, how do we build that off under the COVID and under the different programs? We are taking an active role in how our youth doing. Because our youth need help too. And we're looking at redesigning some of how our youth services program. So we're looking at that. We're becoming that navigational support to the nonprofit community. And as I mentioned before, while I hold weekly calls with the senior population, and it's more information sharing, but eventually I want to turn into more strategy so we can, really be sure that do they have the supports and needs. And there are already a lot of resources that the city provides through tax breaks and so forth, but I want to beef that up from a social service well-being perspective. And then because of our department, we're very active now in many of the variety of partnerships and collaborations and coalitions that to be at the table and say, how can we help and how we can support. And so that's more from a kind of a larger perspective as the department. I now want to shift to kind of give you all an update of the departments that I oversee. And this is really a high level overview, but just to give you a flavor of what the departments are doing or what they've been doing or kind of the trajectory of where they plan to do. So I think you all know Deanna's team in the health department is very, I'll say one more time, very busy. And while there is a health and safety committee, I'm not going to, give a big, but just want to for the purpose of this committee, they continue to stay very active in the data analysis and daily contact tracing. That's what they do. As if anyone is impacted by by the coronavirus. It is the clinical department at the health department that is the key or key entity that facilitates that, whether it's first of all, it's identifying that individual, calling that individual, and sometimes they don't like taking our calls because we have to ask those kind of sensitive questions. Where have you been? Who have you talked to? You have to let them know. So they do that. And then there's a state centralized database that they've all been trained on. So it's a lot of complex stuff, but just to give you an idea, they continue to provide education and awareness because to our community that's here, COVID-19 is still here. While, Norwalk in the state, the trending is looking very well, but we still have to be careful. We don't want to take that as, we're okay. We're not. We still have to practice our social distance and our face coverings and so forth. We want to monitor that. As you all know, it's through the health department that they do the enforcements. They're very active in the dining enforcements, as you all know, and got to make sure that people are following rules. And yes, we do get calls and people will tell us, hey, you need to go to this place, they're not doing right, but that's our job because we want to make sure everyone is safe. And then of course the health inspections, they, very active, what they would normally do, but again, under the COVID. And then one of the things we're thinking about, Deanna's team and us are talking about, there are some critical clinical pieces that we need to bring back online. So like many of the phases that's been recommended, we're looking at by appointment only. Norwalk is the TB clinic. So by appointment, we provide the STD clinic intervention. So we're looking at by appointments, and we will begin to relaunch some of our vaccinations. But again, practicing and managing the social measures and by appointment only, that's something that they do. The big thing is that flu season. We got to keep an eye on that because what that looks like, how that morphs. And so we're in conversations kind of looking at this kind of drive-through program of a flu season because we got to get our residents vaccinated, especially during this time. And then I talked about ERT. Youth services, the youth services provides youth counseling, and they are the Juvenile Review Board, which is our juvenile diversion program. So just like our other mental health providers, we have gone to the video conferencing and telephonic services, and it's going really well. Families are responding. Of course, it's a learning curve for them, as it is a learning curve for our mental health counselors. And with anything, some families are good at it, some families are not. Some families don't want to be bothered. But again, we're working to provide those services in light of COVID-19. And the Juvenile Review Board, I was talking prior to went live, yes, we still are taking referrals. Yes, our young people are still getting, have needs and challenges. And so we're doing that. And we're also beginning online for our hearings. It's through the hearing process that we work with that family and that young person that figure out what are some of the diversion opportunities they can do to kind of give back to the community. Because the whole idea is that to prevent this youngster to going through the juvenile justice system, that's something we don't want to do. So if we can provide the supports and services and some type of retribution program that this youngster can follow, this is the way, and research supports that this is the best way to do that.
Can I ask a question there, Lamont?
Absolutely.
I don't know if you have the data yet, but has there been an uptick in kids getting in trouble, or has it decreased or about the same? I just wonder if there's been an effect of COVID and boredom and, not being in school, things like that. Interesting enough, I was actually on the call with the Department of Children and Families, which is our child welfare organization. And one of the things that we talked about today, and that I'll be talking with our roundtable discussion, is that the numbers have decreased, but that doesn't mean that the need is there. The issue is that, the school is usually the number one reporter. We're not seeing these kids. So it doesn't mean that kids are not, it doesn't mean that kids are not, don't need help, or children may not be in unsafe situations. They're home. And so we're actually have a meeting to figure out, what do we do? Because we know that some kids and families can be in very difficult situations. And similar to the school, it was the school that made the referrals. We still get the referrals from the police department. And I don't have that number, but that's definitely something I could look into. And our next meeting provide some data of really what that trend is looking like in these times. Thanks.
And then early childhood, Mary Oster, one of her key roles right now is, again, in light of COVID, we got to make sure our little ones are being registered for pre-K or kindergarten. And that's been a challenge, but they're very creative. We actually use the food and community sites as an opportunity to inform families. If you have a young one, if they're of age, they should be applying for kindergarten, and we continue to do that. And then again, education awareness and inventory around the schools. We keep a running inventory of open and closed. And also, I will say that I would like to just thank our childcare providers, because they really have been very creative with the stipulations, because we're down to 50% of what they can hold in their schools. And they've all been creative. We've been able to provide PPE and really be a resource to them as for the child cares, because some families had to go back to work, or some families are working and still need childcare services. And so I want to thank our childcare providers who really stepped up to plate during these times to provide those services. And then lastly, our library. The library is not open, but we're really proud to say that last month we initiated the curbside book service. And since we launched this curbside, over 1,600 books have been checked out through our curbside. So you call in, or you can register online. You tell us the books. We'll give you a nice bag with the library books and some goodies, and you come outside and we'll put your bag out there and you take your books. So that's really exciting. We also now have a live reference support call in. So if any resident, hey, I'm wondering about this, you can call in Monday through Friday from 9 to 5. There's a real person on the line that can assist you. We also increase all our online resources. Just in 1 month, we have 730 downloads. We have our Canopy, our online books, our video books. So again, I'm just so proud that our city has responded to our residents in making these resources available online. We also have the pop-up library. They've been visiting our most high need food sites. They've been giving away so far over 1,500 free books to children and their families. Again, practicing social distance, but again, another resource. And one thing that I thought was an interesting statistic, since because of COVID, the libraries closed, we have over 53,000 library cards. That's 20,000 that happened during COVID. So within a 3-month time span, we increased our library cards of 20,000. So, and I want to continue to tell our residents, get your library card. There are a lot of resources that is available to you as a resident of this city, whether online. And then one we'll be thinking about, again, one of the areas that we're focusing on is that one of the areas that I've identified is that whole digital divide. There are still a lot of residents who don't have access to technology. So we're thinking about looking at our neighboring towns. One of the things that they've done in some of our neighboring libraries, again, by appointment only, practicing the social measures, is potentially having the computers available by appointment, because people still need to apply jobs. And we know just about everything is now online. Even if you want to apply for Social Security, workman's comp, the preferred method is online. So that's something that we were talking about, thinking about a phased in by appointment only. Hey, we'll open up, 3 computers in designated areas. You can have an hour to do such that. So you can use the computer, you can print, you can scan, so forth, because we want to make sure that we want to remove that barrier, especially around the technology and resources for individuals that rely on the library for those needs. And then I kind of already talked about it, human relations, I think it's self-explanatory. Anna's team is the department that if the resident is unsure about their rights, or they feel like they were untreated by their tenant, please look on the city's website and call the Human Relations of Fair Rent. We have a live person, again, to help walk you through and provide education and to know your rights. And I think I already alluded to this at our food sites. We continue to do SNAP enrollment. We received a grant from our health department. We gave over 1,000 of the infrared thermometers to our residents. We actually received another shipment. So we're looking to our partners to identify where we can give those out. And so we have 17 sites of our community in food sites, and we actually have one at the Sono Mall. So if you go to the mall, you can get your food. So, Madam Chair, that's it for this. I don't know if there's any questions for the larger community services before I then transition to give an update on the Equity and Justice for All Commission.
Does anyone else have any questions? I would just like to thank you, Lamont, for the presentation. This, it really shows us how much Norwalk needed this department and how much you're the right person to, to coordinate the services. We kind of knew all the services were there for people to meet their needs, but there was no coordination of those services. And you have really, really done a remarkable job of doing that. And I want to thank you for that.
Thank you.
Okay, so let's move on to 4B, which is an update on the Equity and Justice for All Commission.
Thank you again. So thank you again. Let me first say, obviously, this is personal and dear to me, and I'm really excited, both from the Common Council perspective and the mayor, that this was really important to all of us, that we're able to do this. And I might add that it appears that, from a state perspective, that our approach is very unique of how to address these times. And so we're actually getting a lot of calls from our neighboring communities asking us, can you tell me more about what this is? How you all are doing it? So I'm really excited that people are looking to our city as a leader in figuring out, because this is not going to be an easy task or easy work, but we're moving in the right direction. And so for the purpose today, I want to give an update on the Equity and Justice for All. As you recall, when Mayor Rowland gave the last town hall, he mentioned that he wanted to launch an Equity and Justice for All commission. And then I participated on one of his town halls to give a overview. And so I'm happy and really excited to talk about, we are moving. And as of yesterday, the actual RFP was launched publicly, and it's moving around the state and the country, because it was important to us that we did not want to just add this. If this work was important, we did not want to add this responsibility to another employee. If we were going to do it right, we really need to look at professionals and experts who do this day to day to say, hey, help us think through what is the best way to do this. And so we're actually doing just that. And so for the purpose of an update, this is the broad purpose of the equity. I want to just remind us that once we hire the consultants, they're going to help us refine this, but this is really a framework in terms of how we're thinking about it, but we are going to look for them to help us refine it and kind of massage it for us. But for the purpose of this discussion, we are preparing to launch a commission of local leaders and community members, which is representative of our city, who are dedicated to education, dialogue, and action surrounding race and ethnicity to effect change. Mayor Rilling also mentioned that there was a 1993 Blue Ribbon Report on race relations. I read the entire thing. I think it's about 90 pages. And what he has commissioned is that we would like to use that as a template. It's really good information. It gives us the groundwork of what happened, what was thought through, and then where we need to pick up and where we need to focus on more and can do a little bit better. And so we are using that template, and I would encourage those that are watching, it's available to the public because it was a public document to give you a sense. So we're not starting from scratch. I think what we're doing is launching and creating a more focused framework in these times. And so we want to build awareness, solutions, and direction for racial justice and equity. It really is that simple, but we want to do it right, and we want to hire a professional team to help us do that. And so a quick update is that we finished the draft RFP. I think it's about 40 pages in itself. And I also want to share with the public, we had to create it. So it did take a little bit more time than we have originated because we created the framework. So it took time to kind of think through, what do we want in it? Let's make sure we're sensitive to all of Norwalkers. And then we asked some experts to weigh in to help us refine it. So it's prepared, it's been released. The mayor will be preparing to release a press statement just to let the public know and the community know that it's been released. We are in the process of identifying a selection committee to select the committee. I can share that our Madam Chair has been selected or will be representing the Common Council as a selection committee. This committee is just to select the awardee, the organization, the consulting firm. And then once we select a consulting firm, this selecting firm would help us identify, again, based on best practices and strategic planning, who should make up the commission. Because as you all know, we're receiving many calls. I can probably tell you about 50 people want to be on the commission, and that's great. That's a good thing. But in order to get real good work done, there's no way. However, what we can do is that through the consultation with this firm, we will identify the commission, but then we can identify mechanisms and be very clear. How do we then keep the community abreast at all levels? So although everyone can't be on the committee, it will be our responsibility, and we're very sensitive of ensuring how do we inform and keep the community of what's happening, and we have strategies to do that. So as of today, as of yesterday, it's been released. It's online. Members of the public can look at it. Members of the public, if you have your own consulting firm or of folks, I'm encouraging you to apply. It is definitely will be a competitive bidding process. We are following our general bidding and procurement ordinances. So that is the process that we are following. We will be closing the bidding process on August 11th, and then we will then begin bringing the 7-panel member together to select the awardee. I will add too, one of the things that we added that I think was very important is the top 3 organizations, the top 3 consulting firms that the selection committee will be selecting. We will have a public kind of informational. The public will not be selecting them, but we just want the public to ask questions. So as the selection committee, this will be kind of that final piece that the selection committee, the collection committee will have an opportunity to observe how they talk to the public, how they answer the questions, because one of their main roles is dealing with our community. So we want to make sure that the nuances and they understand our community. And then from that final stage that we will then select the consulting firm. So I'm really excited. We're following the best practices across the country of when you're doing this work, what is the process? And I really feel proud that the public will appreciate the transparency and the process to select the final awardee to help us begin to look at equity and justice in our city. And then lastly, I just want to, if it's okay, Madam Chair, I just want to remind the public that we do have a volunteer survey. We're always still looking for volunteers, so that's online. If you want to know what the community organizations are or who's helping, please go to our website, norwalkct.org/city news, and you can find us online and you can understand and learn what the supports are. We work to keep that up to date every day. So that's it for me. If there's any questions, Madam Chair, I'll yield back to you.
Yeah, I actually have two things. Can you just share with the committee who will comprise? I know you don't have the specific names, but who will comprise the 7-member panel?
Yes. So we're asking the NAAC to offer a representative. We're asking the IMF to offer a representative. We're asking Norwalk Acts to offer a representative. We're asking the Connecticut Youth Leadership, because the mayor felt very strongly we want to have a young person as part of the selection committee. We're just trying to find a young person because these proposals are going to be about 30 pages each. So a young person it's okay with reading, and we don't know how many we're going to get. And then we want to be sensitive to race and ethnicity. We're asking leaders from the Hispanic Latino community if they can identify someone in that community. And did I get to 7?
Board of Ed.
And yes, thank you. And Board of Ed, thank you.
Okay.
Thank you.
And then another question that I have is, once this consultant is hired, how long a period of time will they be, facilitating this commission?
The current proposal reads 1-year contract.
Okay, any other questions? Comment? Okay, thank you. Yes, this commission is very, very important to the council, to the community, and it's important that we do it well and we do it right. So, so thank you for that update.
Thank you very much. And thank you all.
Okay, so the next item on the agenda is the executive session, a discussion regarding application for benefit under Public Act 19-111. I just want to say, before I ask for a motion to go into the executive session, is there will be no votes, no actions of any kind. This is informational and for discussion purposes. So I think that once we go into executive session, Darlene, as our recorder, I do not think that you will need to come back. We can email you with the time of our adjournment.
Okay, great. Thank you.
Yeah, so because nothing will occur in terms of actions. So that being said, do I have a motion, please, to move into executive session?
Motion.
Okay, I think that was Mr. Keegan. So we are going into executive session at 7:50. So what we will do is we will leave this session and then we will log into the other link that was provided.
Yeah, once everyone's in executive session, I will get out and I will make, Barbara, I'll make you host, and that way I can get out of the session. It'll continue to run.
Sounds good.
All right.
Okay.
Have a good night.
Okay. Bye, Darlene.
Bye, everybody. Have fun.